It's CommonWell TV 2021, right here from our Orlando studios, where we're introducing you to some of our CommonWell Health Alliance members, but also introducing you to some of our very own CommonWell team members, including Nick Knowlton, who is our CommonWell Board Chairman, but he's also the Vice President of Strategic Initiatives for ResMed, who is the parent company of Matrix Care and Brightree. And so, Nick, let's start off with this. How will health IT really forever be changed by the pandemic?
That's a great question. I think of multiple different areas, but to just focus in on a few of them. Number one, I think telehealth is here to stay. It's sticky. We know CMS reported 1% of PCP visits in February of 2020 were done via telehealth, and by April, that number had changed to 49%. Optum reports that there's still 10 times as much telehealth encounters on a go-forward basis as to what they saw prior to the pandemic. So I think we can all agree that telehealth and remote patient engagement technologies are going to be a much larger part of the health IT landscape on a go-forward basis. Number two, I think the pandemic actually provided a lot of tailwinds to emerging and existing interoperability trends. As we all well know, multiple different care providers got pushed out to remote settings themselves, and a lot of paper-based workflows that interoperability was always designed to replace moved from being a nice to have, and yes, we'll get there, to being an absolute necessity. So we can see all sorts of statistics across the ecosystem about how much more connectivity was put in place and how that all emerged. Furthermore, I think that the pandemic drove home the need for modern, scalable architecture systems behind those interoperability capabilities. With all the development staff and implementation staff pushed out to remote settings as well, we saw a lot of the modern SaaS-based, FHIR-based technologies really take off to further power the interoperability ecosystem. And then in terms of permanent trends, I also think that we're going to see tremendous stickiness for patient-facing, patient engagement, patient journey type tools. We all did the stay-at-home thing. We ordered from Amazon, we ordered groceries from Shipt or another application, and we got to track all of that in real time. And I think that is going to further empower the rise of the patient as a consumer. They're going to begin to expect the same experience in their health journey or the health journey of their loved ones as they come to expect in, being able to track other things that they pay a lot of money for. I know that a lot of us also have family members going through complex care journeys, near and dear to my heart in post-acute. I deal with this with my father every day. I want more visibility into his care journey, and I'm willing to change provider organizations so that I can get that. We know the technology exists, and I think that you're going to see a massive revolution in the next 12 to 18 months in post-acute, but also in other care settings as well.
Nick, what was CommonWell's reaction to the ONC info blocking regulation?
Well, CommonWell's reaction is, hey, the more interoperability opportunities there are to establish good swim lanes for data to move in a patient-centric manner to help out treatment and other use cases. That's always a good thing. To be honest with you, though, I'd love to speak about it from the ResMed, Brightree, Matrix Care standpoint. Post-acute care has always been underserved when it comes to interoperability, and anything that opens up more swim lanes for our providers and our providers' patients to connect to the rest of their care journey so that post-acute doesn't exist in a separate silo or bucket. That's a good thing. That's an opportunity for our industry to help move forward.
You've mentioned post-acute care. How is that improved for the patient when it comes to data exchange?
Great question. So we actually joined CommonWell to represent the needs of the post-acute care provider. Prior to the newer existing ONC regulations, there were a lot of other interoperability rules and interoperability plans and nationwide interop roadmap that were really designed to focus first and foremost on ambulatory physician practices, hospitals, health system needs, and the like. And post-acute, frankly, was left behind in, the design of a lot of that. We're very documentation heavy. We're very community workflow driven. There's different needs for when discrete data about patients needs to show up in a patient's care journey to ensure that they can get the care that they absolutely have medical necessity for. And we joined CommonWell to have a seat at the table to be able to drive those conversations for, don't forget about post-acute. And I think we all see these trends out there now. Value-based reimbursement and the pandemic have certainly accelerated them. But pushing, patients to home-based care where appropriate. It's a lower-cost care setting. They're surrounded by their loved ones. This is something that, the post-acute care community can really offer a lot of value to the rest of the ecosystem to keep patients safe, to keep them healthy, to keep them out of the hospital. And this is precisely the type of thing that, when we joined CommonWell, we wanted to help accomplish, which was make sure that the workflows that are being designed, the specifications that are going to be employed, that they can accurately meet the needs of the post-acute care provider and post-acute care patients. And that's been, a really successful experience in our eyes. We found a very open and willing, group of participants to make interoperability better together and, bring post-acute into, the modern era of interoperability and connected health. So it's been a tremendous evolution in terms of what that has meant for our connected providers. But even beyond that, just the community, the general membership of the Alliance, it's a great opportunity for conversations about things that go above and beyond what we can solve just through the mechanisms of the Alliance. So it's been a very good journey so far, and I think there's a lot more to come in the next couple of years that will be very exciting for post-acute care.
He's Nick Knowlton, the board chairman for the CommonWell Health Alliance. And for more on CommonWell, we invite you to log on to commonwealthhealthalliance.org. Nick, thank you so much.
Thank you. Have a great day.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.